Hi everyone, how are you? Welcome to another question and answer session. This is the physiology portion of eMRCS. So first of all, read the question very carefully. Which of the following drug causes hyperkalemia? So we have to find out the causes of the hyperkalemia. That means increased potassium level in the blood. So we have to find out the drug which causes increased potassium level within the blood or within the plasma. So here the options. Options are the heparin, ciprofloxacin, salbutamol, levothyroxine, and codeine phosphate. So first of all, to know about the calcium, first of all we have to know about the normal body distribution of the calcium. So let's see the body distribution of the calcium. That means proportion of the calcium in the ECF, ICF, or other area. First of all, here we can see this is the potassium, and this potassium is presents the maximum portion on 155 millimole per liter. It present in the ECF. So this point is very important. ICF, that means it is the fluid which is present within the cell. So the potassium, it is very high within the cell. That means it present in the intracellular fluid. But in the extracellular fluid, that means in the plasma and interstitium, that means within the blood, the potassium level is very less. That means it is the 3.7 millimole per liter. So potassium, it is present in the plasma and interstitium very low. In the plasma it is 3.7 millimole per liter. And we know when we measure the calcium level, we measure only this plasma level of the potassium. So the potassium 3.7 usually we measure in the blood, but when this blood level will increase, so it is very easy. If we can destroy any cell, that means if we destroy this cell, this 155 millimole per liter potassium will release in this plasma. So it is very easy that any substances, any injury, any physical injury or chemical injury or drug or any other condition which causes injury to the cell, it causes release of this potassium into the plasma, and in this condition plasma potassium will be increased. So we have to find out the drug, we have to find out the agent which causes damage of the cell, because cell is a bag of potassium. So potassium, it present within the cell, and for this condition cell is known as the bag of potassium. So if we want to get more potassium in the plasma, we have to damage this cell. That means the ICF fluid should be enter into the ECF fluid. So here in this picture we can see the potassium, the higher portion of the potassium it present within the cell. Here we can see the higher amount of the potassium, and this is the extracellular fluid. If we think the extracellular fluid, they are the sea or ocean, then we can see that the potassium or cell is a bag of potassium, and this potassium bag is floating in a sodium rich sea or ocean. So here we can see the extracellular fluid, it is high content of the sodium. On the other hand, the intracellular fluid, it is high concentration of this potassium. So this information is very important for us. And this picture also, here we can see this is a cell, this is a cell, and this cell contain different type of ion, but among them the potassium is a higher concentration, it is 120 millimole per liter. On the other hand, the sodium, it present more in the extracellular fluid, which is the 140 millimole per liter. This concentration may be varies in different areas, but it is important to know that the extracellular fluid, it is rich in sodium, and intracellular fluid, it is rich in potassium. On the other hand, this cell is a bag, and this bag usually filled with potassium. That means a cell is a potassium containing bag. On the other hand, the sodium is a C which contains sodium. So in this C there is a bag which is filled with potassium, and if we want this potassium out of the cell, we have to destroy the cell. So now see the causes of the hyperkalemia. That means we have to find out the cause which may damage the cell. So first of all, acute renal failure. It is important in case of acute renal failure. We know that the tubular cell of the kidney is damaged. So tubular cell of the kidney damage first. So first of all, the kidney cell damage, potassium increase in blood. On the other hand, as kidney fails, it cannot excrete the potassium through the kidney. So hyperkalemia develop in case of the acute renal failure. And here we can see some drugs, and it should be memorized. Here we can see potassium is sparing diuretics, ACE inhibitors, angiotensin 2 receptor blockers, spironolactone, cyclosporin, and heparin. So these drugs are the most important cause of the hyperkalemia. Then metabolic acidosis. In case of metabolic acidosis, we know acid is damaging power in our body. So it causes the action, or it may cause damage the different cells of the body, as well as it may release of hydrogen ion from the different protein or from the hemoglobin into the blood. Then here we can see the addition disease. It may also cause the hyperkalemia, because in case of addition disease, the metabolism altered in our body, and calcium and potassium cannot be excreted through the urine, so potassium level may increase. Then tissue necrosis. So here we can see tissue necrosis, that means the cell damage. Then rhabdomyolysis, it is caused by the breakdown of the muscle is a cell, so there is huge number of potassium, it enters into the blood. Also the burns, following burns, the different type of the ion enters into the blood vessel, including the potassium. Also the trauma causes the damage of the cell, and we know the cell is a bag of potassium, so injury to cell, damage to cell will increase the potassium level. And massive blood transfusion, it also the causes of the hyperkalemia, because massive blood transfusion, if we store the blood, then the stored blood, RBC, WBC, and platelet, they will broken down, and the cell, it release the potassium, and finally potassium level will be increased. And here this point is important, both unfractional and low molecular weight heparin can causes hyperkalemia. So heparin, any form of it causes the hyperkalemia. Then we can see this is thought to be caused by inhibition of aldosterone secretion. Salbutamol is recognized treatment for hyperkalemia. So salbutamol is the, or salbutamol nebulization by the salbutamol or salbutamol tablet used for the treatment of the hyperkalemia. But where the nebulization available, there should be used the nebulization, because the nebulizer, it acts more rapidly than that of the tablet. So here our answer is ready. Which causes the hyperkalemia? It is the heparin, which is known to us, and other options, they are not true. And the key point from the question is only one point, that is any causes which damage the cell, that will increase the serum potassium level. So we should not forget the cause, or that line, that the cell, any agent which damage the cell, that will increase the serum potassium level. Thank you all.